Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Chrissie Ott. She's a pediatrician. Today's Kevin MD article is When a Pediatrician is the Parent, a Personal Reckoning with Childhood Obesity. Chrissie, welcome to the show.
Thanks so much for having me, Kevin.
All right, so let's briefly share your story and then share the Kevin MD article that you wrote for us today.
Yeah, absolutely. So I'm a med peds doc based in Portland, Oregon. I have worked in primary care, in hospital medicine, and now long-term care for kids with medical complexity. I have a background in nutrition and integrative medicine, and so all of that would make me think that I was uniquely qualified to address pediatric obesity when it occurred in my own family. But I was wrong.
So tell us more about the story that you articulated in your article.
Yeah, I decided to write this article, and it was a bit of a surprise to me. But after years, really, of feeling stuck and unsatisfied with treatment options for my sweet kiddo, and just confused, wanting, like all parents, to help without harming, to not be part of bias and stigma, but also having a really deep concern, and as a medical professional, really knowledge about all of the health risks associated with a highly elevated BMI or rapid weight gain or weight cycling. It just felt like, you know, the counseling that we were getting in routine pediatric visits was not adequate, was
Mhm.
not moving the needle. And there were so many ways, Kevin, to get it wrong. And I was like, if I'm paralyzed at this juncture as a person with a background in nutrition, pediatrics, and coaching, I don't know who's getting it right. So let me dig deeper. I felt like there was an aha moment where I realized, oh, this is a metabolic condition. I often fall short of calling it a disease, which, the Obesity Medical Association and other professional organizations absolutely do recognize it as a disease. I prefer the word condition because I have a little bit of a foot in the health at many sizes world and a foot in this, we actually need to treat a medical condition with a medical solution. So in my own family, I have a child who's almost 12, and we've been through different phases of time where there was hyperphagia. I didn't have that word readily available to me, but I knew that my own response to her dysregulated eating was telling me something is wrong.
Hmm.
Stopping her didn't feel right, like restricting food doesn't feel at all right, or encouraging her to exercise from a place of my own confusion and distress also felt just off. Like how do we do this with a child whose satiety signals are actually unreliable? And, for what it's worth, she also is a kid with an ADHD diagnosis. And so her dopamine reward system, her impulse control, her executive function are all impacted by this confluence of factors. So I just found myself at a really high level parenting confusion moment, even as a medical professional. This thought that we have a medical condition here that requires more than a behavioral intervention reminds me of this analogy. Like, we don't tell people with hypothyroidism to drink more coffee and put on more sweaters,
Hmm.
right? We offer them a root cause solution. And I just began for the first time to understand there's a root cause here. It's a pathophysiology. Her brain and her body are set up to be out of balance. There is now actually a medical intervention that's FDA approved and could help her. So I just decided I'm going to find somebody who can help. And that's where all of this began.
So you said that your response to your daughter's hyperphagia, you said it felt off. Tell me some of the tension that you were feeling at that moment, given the traditional education that most internal medicine pediatrics physicians have up until that point.
Yes, for many years in primary care, I was preaching Ellen Satter's usually very good advice, which is parents are there to decide what food is available, and the children should take the lead in whether or not to eat and how much to eat so that we continue to develop trust in our own bodies, satiety signals. But what Ellen Satter, amazing dietitian and teacher and author, did not necessarily consider, in my humble opinion, was the children who have genetic, polygenic, or
Hmm.
monogenic setups for obesity syndromes, especially in a food landscape full of highly palatable, habit-forming, ultra-processed foods that are harming bodies and eating habits at a very high rate, coinciding with screens ubiquitously entering our lives and ongoing factors. The tension that I felt with my daughter's hyperphagia was I am very devoted to her emotional well-being above most all other things, which is not to say I get it right all the time, for sure. But I did not want to harm her dignity.
Hmm.
And also, I am the adult who needs to put some brakes on, right? If my child is running into the street, I will stop her by any means possible, by any means necessary, even if that means yelling
Hmm.
or, physically stopping her. So it was feeling like that tension, but because we have so much emotional baggage and material around food habits, eating habits, body sizes, and weight, I was trying to hold the like, I don't want to oppress my child's body. She can be whatever size she wants, but also this behavior, I can see this behavior is out of control. And it's not just emotional eating, it's actually that she has no breaks.
Hmm. So tell us what happened next after you reframed your daughter's hyperphagia and termed it as a condition. What happened next in the story?
I got curious about medical intervention for a medical problem.
Hmm.
And, I had been at least aware enough of that for a year that we'd been on a wait list for a healthy lifestyle clinic, which is our tertiary care provider here. And it is primarily focused on behavioral interventions. But as a former nutrition person who is, I am well versed in healthy eating and healthy lifestyle habits, that wasn't our primary deficit in this household. We did not have, lots of soda or fast food habits. However, even with that, we couldn't get in. We were on a wait list for a year.
Yeah.
I wasn't aware of anybody in my area actively practicing obesity medicine for pediatrics. The one person who I knew of had retired, and I just was realizing this is such an unmet need. So I found an adult obesity medicine provider who was willing to see my daughter, and we talked about the pros and cons and the risks of intervening and not intervening, and ended up going on a, slow, steady journey of like, let us try this approved oral medication for a while, and then let us also add some structured exercise, and let us also talk about healthy plate and, healthy lifestyle habits, of course, at the same time. And then eventually we added a GLP-1 and have been increasing it according to the increase schedule. That has made the biggest difference. I
Hmm.
have seen my child's hyperphagia actually regress back into more like an average appetite. Not a suppressed appetite. She still very much loves and enjoys food. And I can see that she actually has breaks now. She can say, "Oh, I don't want to finish
Hmm.
that. I'm full." And I'm always on the lookout for, restrictive patterns because the last thing I want to do is also provide in, input that would cause my child to go down a road of restrictive behaviors or valuing thinness over well-being. No, that is not where we're headed. But trying to find a place where we can work with her physiology to support trustworthy, reliable satiety signals. That I am excited about. And I think there's so many kids out there and families who must be in similar conditions and who are like, what can we do? We don't we don't want to be restrictive to our child, but we're also seeing and knowing that there's something out of whack here that we need to intervene with.
So take us a little bit into those discussions. You said your child was an adolescent. I think you mentioned 12 years old or so. Take us into the discussions about starting a GLP-1 agonist in her. What was it like with the discussion with the adult obesity medicine physician, and what was those discussions like with your daughter?
Great question. In this age group, what we need is assent, informed assent rather than consent. So the TLDR version is that she was very much on board.
Hmm.
The background information is that she has been, the victim of weight-based victimization or bullying at school, off and on for a few years. And it has really impacted her social growth, her understanding of herself as whether or not she was desirable. So I'm naming, fat shaming and stigma, which is not in itself a reason to undergo medical treatment, in my estimation. However, it is a part of the landscape that I think needs to be named
Hmm.
because it was impacting her emotional well-being in a very, very deep way. She was shy, she was withdrawn, she was not taking social risks. And we asked her, if I could connect you with a doctor who specialized in weight loss, is that something you'd be interested in? And she was like, oh my gosh, yes, yes, mom, I really want to meet them. When can I meet them? Can I go tomorrow? And so we met the doctor and we talked about options, included her in the conversation. As our listeners all know, GLP-1s are injectable. My kid, like most, 11, 12-year-olds, is not a fan of shots. And so for this kid to be aligned with taking a shot once a week in her belly, I can't even tell you how much she must have wanted
Hmm.
change, in her body. Again, monitoring for, are we reacting to stigma alone, or are we also doing a service to work with her physiology? And how can we balance this both and thread the needle of being a safe space for people to be in whatever size body they need to be in, and also offer health affirming medical treatment that results in weight loss when it also makes sense.
Now, how has that journey gone, and how long has your daughter been on a GLP-1?
She's been on a GLP-1 for about 3 months now. She has lost weight, about 12 pounds. She has noticed changes in her body and she's very pleased with it. She feels more confident. She is celebrating herself in the mirror. I mean, I joke that my child is what Jack Black would be if he inhabited a tween girl's body. And so
Hmm.
she's just, hilariously celebrating herself all of the time, even more than she did before. And I see her taking social risks and just feeling proud of her new strength and speed on the softball field, and is like, she's really, she's very into it. And, her lab work shows improvement as well.
So I prescribe GLP-1s in my adult patients, and as you know, these are longer term medications, and in adults, the weight does tend to come back after stopping these medications. So prescribing it to someone who is 12 or 13 years old and knowing that it has to be long term, how did you address that facet of that therapy?
I think that that is probably a partially to be determined component of our journey. I do think that over time we will have more options. I think that, over time, gradually reducing the dose while also upregulating those healthy lifestyle interventions. Also accepting that the treatment of the propensity to obesity is much like treating some other chronic conditions that may require some level of lifelong treatment
Hmm.
and titration. I don't know the answer yet. I'm really, you know, game to find out, and also quite averse to blindly following Big Pharma's lead all of the time. I uttered my disgust as part of the article. So 2 years ago, when FDA approved GLP-1s down to age 12, I was angry. I felt protective of those kids. I thought they would be victimized by this big pharma reach. And I think that's one of the most surprising things, is that I find myself flipped on the other side today, going, I am so grateful that this tool has entered my daughter's life at this time. Don't know what the future holds, but I am open to leading the way and being part of the solution.
Do you still feel like there's a stigma against GLP-1s in patients that young? Do you feel that there are a lot of parents and pediatricians, for that matter, who feel how you initially felt?
hmm I think stigma and fear both. So I just had an exchange with a highly regarded dietitian in my community who, is a health at every size proponent and and I think feels passionately that this is a wrong choice.
Hmm.
And I have had one or two other commenters who felt protective towards my child and felt like this was a wrong choice. I honor our difference in this way, and that's okay. I have been more surprised by the flood of physician parents who reached out and said, "Thank you so much for writing this. This describes our situation so
Hmm.
much." In the clinical environment, I think our pediatrician colleagues and adolescent medicine colleagues, it's new. It's new, and we are taught to not be comfortable for a while with what's new for good and, you know, for good reason. This may change over time naturally. I think it takes a lot of bravery to step into this. And honestly, there's so much to know that it really makes sense to find a diplomat of obesity medicine in your community who is a pediatrician or familiar with prescribing for kids on the younger end of the adolescent spectrum. Not all of us can travel to a tertiary care center to find that. And some of this may be only accessible through virtual health visits. One of the ways I'm hoping to help that problem is to partner with primary care clinics to help them expand their range of comfort in treating obesity with the full scope of tools at our disposal. I don't know how that's going to work out yet, but I think that, helping primary care docs expand their comfort is you know, a step in the right direction. And just also modeling it and getting more data and more anecdotal and documented experience about safety and efficacy. And, I can't wait to get more data.
So you said two things that caught my attention. Number one is that you had an outpouring of people who reached out to you saying, thank you for writing about this. And we are in a similar situation to where you are. But you also said that you were literally judged by people who said that you were making the wrong choice. Tell us the
Mhm.
advice that you can give to these parents who may be in that situation and want to start a GLP-1, but they're inevitably going to be facing some judgment if they make that decision.
Yeah. I think that being really clear about your intentions, like being anchored in your decision, will help. So maybe don't do it until you're really clear about your intentions, that you really feel like you have thought through. This is not a decision to take lightly, I don't think. I also believe in getting an opinion from somebody who has this expertise, somebody who's studied it specifically. So whether that is, a referral from your pediatrician's office or you find somebody online, there's a great resource for clinicians and families alike. Obesitymedicine.org has a area for pediatric resources, and then obesitymedicineproviders.com is a place where you can find people who are certified in obesity medicine, and it's of course searchable by your zip code, and then you can kind of narrow it down. And I recommend having at least an initial visit to explore with these folks. Admittedly, pediatric providers are harder to find, but there are some resources out there. And, kids can thrive at many different sizes, but I love the future in which they have access to effective tools.
We're talking to Chrissie Ott. She's an internal medicine pediatrics physician. Today's Kevin MD article is When the Pediatrician is the Parent, a Personal Reckoning with Childhood Obesity. Chrissie, let's end with some take home messages they want to leave with the Kevin MD audience.
Absolutely. If you're feeling unsure about how to help kids in your life or your practice with health concerns related to weight, there are important tools beyond the behavioral and lifestyle strategies. It is a both and situation. Find someone to support you, get more information, and don't stop asking the questions until the right answer has landed.
Chrissie, thank you so much for sharing your story, time, and insight. And thanks again for coming on the show.
My pleasure. Thank you for having me.